straight
No.
up. Turn this way now. Lift it up. Turn that way. No, you can't hold either. Okay.
No.
Hold it this way. Hold it up. That side's stronger, is it?
It is stronger, yeah.
This side is much weaker, is it?
Yeah. Shaky.
And this is also weak, right?
Yeah.
And this one. Okay. Put your head down. It shouldn't be like that. You should never have such a weakness that you can't hold it out an extension like that.
Sometimes it feels like my head, I can't even hold my head up
You
on my
should never
elbow.
have, you should never be like that. Turn. Hold this up hard.
Hold this
Keep
up?
your head
Okay,
down.
yeah.
Turn. Turn the other way. Thumb up to the ceiling. Hold it up hard. Hold it up hard. Thumb to the ceiling. Thumb to the ceiling. Turn. No, don't. Just hold it there.
Sorry.
Thumb to the ceiling. Hold it up. Hold it up. The other side. Thumb to the ceiling. Hold it up. Turn this way. That's it. Hold it up. And turn this way. Hold it up. Okay, relax. Okay. Alright. On your back. I'm taking a video of this, by the way, if you're okay with me
Okay,
using this
yeah.
video. On your back here. Hold your head up. Hold it there as hard as you can. Don't let me push it down. Not able to do that. Hold it this way as hard as you can. Turn all the way. Hold it. Turn. Hold it. So this side is worse, is it?
Yeah, I think so, yeah.
Yeah. Okay. This way. Just doesn't go. Hold it this way. So it's a little stronger, right?
Yeah.
So it's kind of weak on both sides, but stronger on the left, eh?
I think so, yeah.
Okay. Let's look at this now. One more time, sitting up. Facing that way. We're going to test also the muscles. We're going to test also the muscles in your shoulders where the nerves are going into your arms.
Okay.
Okay. But this is particularly uncomfortable, right? This
It is, yeah.
anterior scaling. This is not so bad.
Not as bad, no.
Uh-huh. This
Yeah.
and this.
That's uncomfortable, yeah.
But the worst is this way, right?
That is the worst.
Yeah. It's the anterior scaling shortness. This was also quite
Yeah, when you
tender in here.
that's very tender. The most.
Opposed to this side. Not
Yeah.
as bad. But this side has tenderness here,
It
right?
does.
Yeah. We've marked all those down. Okay, that's the semispinalis. Splenius is short on the right. And weak. Marking that in. And yeah, the whole thing is like okay. Now we're going to check the function of the nerves going into your arm. Hold this up hard as you can. Okay, relax it. I'm just going to check the blood supply coming in here. Breathing in. Hold it. And relax. some blood's getting compressed in there as well. Hold it this way for me. Hold it hard. Hold it. Hold it this way. Hold it again. That's a little bit difficult, right?
Yeah.
Turn this way. Hold it up. Keep it turned. Hold it up. That one's also turn all the way. Hold it. That's also kind of hard, right?
Mm-hmm.
So hold it up. And that side's strong, right? So that's your C6, C5, 6, both of those muscles.
Okay.
Okay. Hold your wrist like this. Hold it hard as you can. Straighten it up. Hold it hard as you can.
Which one's that?
Hold it this way. No. Keeping your fingers going like this. Not as bad there yet, so the C6 is a problem. So, C6 is a problem, and C6 is a problem. Okay. So the nerves going from that, where the compression is, are definitely not working properly into there. You can see this minimal, hard to read. A minimal or moderate disc osteophyte, abutting of the ventral cord, effacing of the ventral CSF space, mild to moderate spinal canal stenosis, moderate bilateral foraminal stenosis at C5-6. So that's not very good. I'm just getting all the symptoms into the arm, shoulder aching in here, burning in here from the nerve root compression, and pain and tingling into the hand as well, the fingers of the hand. So. That's what we have. Okay. What I have to do, that's it for now. What I have to do, review your x-ray findings. We're going to correlate those with your MRI and with your examination findings. And then when you come back next time, I'm going to tell you exactly what we're going to do. We're probably going to have to do a procedure, specific procedure. Really sort of a non-surgical operation, if you will, a number of procedures sort of combined to restore movement. The bones in your neck are, because of this deterioration, you've got to really not moving properly, but the movement can't be restored just simply by manipulating the bones. It has to, we have to actually do certain procedures that will actually restore the behavior, the functionality of the muscles that are small muscles inside your neck.
Okay.
And there's a number of them. They're all marked here, what I've got to do with you. It's all marked in here in terms of which muscles are receiving almost too many signals, if you will, from the brain. They're contracted internally, and they're restricting the motion of certain segments that is causing deterioration of the disc and compression of the nerves that are going down into your arm. So when I see the x-ray findings, I'll know what I can safely do. And then either that day we'll do the procedure or the next day. But we'll do it. It'll be quite painful.
Okay.
Okay. So be prepared. If you want to take some painkillers before you come, you can do that. I'm going to have one or assistant in the room helping me, holding your body in certain ways that will enable me to have the structural support that we need for me to be able to really isolate the areas that I need to isolate and work on.
So is it like an adjustment, or
Not,
it's an actual?
there'll be a couple of manipulations we'll do more or less at the end of it.
Okay.
And the manipulations may be a little more forceful than you're used to.
Right.
So it's kind of it's a hybrid of chiropractic or osteopathic manipulation, something I've developed over the last 35 years, basically. Okay, so it's kind of, but just to do the manipulation alone initially is not going to work, and just to work on the muscles alone is not going to work. You have to change. I don't want to treat your muscles or your shoulder or your spine. I want to treat your brain. I want to change the way your brain's actually communicating with all those muscles in there that are dysfunctional now. And then I'm going to do a couple of substantial manipulations, spinal manipulations, that, if it's all done correctly, should hold and then should pave the way for some regeneration of that disc and whatnot. Now, when I look at the pictures, you may, in addition to the procedure, we may need to do some spinal disc decompression if they're really compressed badly. That's something you can't just open it up in one day. That may take time and some work. We have a digital disc decompression machine here as well, specifically for discs that have deteriorated. We've got laser as well. It's very good and healthy in helping a disc. We're probably going to have some type of program to regenerate the disc a little bit, to get a little more space to kind of get the holes to sort of open, a little bit where they're being compressed, and to take the pressure off the spinal cord. All of that has to be done. And you have to get that all done in a way that prevents further deterioration. So there may be some structural changes that we have to make as well. It looks like your head is too far forward, and you may have a bit of a reverse of the normal curvature. We may need to do some structural work to bring that back, to take the pressure off that C5-6 disc. There's a reason that it's deteriorating prematurely, and at that level specifically, and not the other levels. So we have to also address that. So all of those things have to be put together into one ball of wax, and then treatment program, and then we'll do it. So it'll be procedure. But the procedures that I do, it's not like chiropractic or osteopathy. First of all, I don't charge for my time. I charge for experience and for results. All of my fees are flat rated. So if it's a procedure, it'll be a certain rate, specific rate for that procedure, regardless of time or whatever it takes. It's like surgery. If you go in for an hour, you pay for that surgery. There's a flat rate for the surgery.
So they can tell me, once you've seen everything, then they can tell me how much that would be?
I'll tell you. I'll tell you. And then when I do these kind of procedures, they should be fairly sustainable and permanent. It's not, like I say, it's not like chiropractic where you have to go, X number of times over X number of months. Yeah. We may need to do some follow-ups for sure, but the major work, 80% of your results, is going to be in that first procedure.
Okay.
Okay. And yeah, it's quite dramatic, but it works. It really works. Okay. Any questions?
No.